It is an honor to be here at the Prime Health Summit with April Giles, the President and CEO of the Colorado Bioscience Association. Thank you for taking the time to share your wisdom with us today, and it's great to spend time with you.
Well, thank you. I'm excited to be here and to talk with you a little bit more about things that are happening in our community.
You've really been a leader in the ecosystem here over many, many years. You've helped grow it. It's such an exciting time, and I thought we'd start with your mission and the mission of your organization and why that's important, what you're doing.
Well, thank you. I mean, our association has been around since '03, and we really believe that our mission is to serve our community. And so we do that in 3 different ways. We do a lot of educational programming, throughout the year to help our companies just navigate the intricacies of the environment that they're living in. We do a lot of advocacy work at the Capitol, so state and also federal policy work. And then really the heart of who we are is creating networks, getting to know the people, understanding the challenges and the opportunities that they have in front of them, and really opening up the window for them of who they need to be talking to and how we can help them succeed to get things out to patients and to take care of our community.
And it's such an exciting time for health innovation, and one of the things we're so excited about at Startup Health is really seeing the cross-pollination of different types of health innovation. There's bioscience, but you also do a lot of work with digital health.
Yes.
Talk a little bit about the cross-pollination you're seeing, and it's really all blending together to create extraordinary things.
Colorado is an amazing place right now. I mean, you're right. We have one of the best software technology ecosystems in the country. Life science is now ranked nationally. We've got the convergence, of the 2 ecosystems in a major healthcare community that's moving into digital health and understanding that the connectivity between all of those ecosystems only makes the work that we do better. We're an environment, Colorado really is an environment where people are highly collaborative and always want to push the edge and work across the line and reach out and pull people in. And so, having that kind of culture as a community and then having these ecosystems that are really innovative in the work that they're doing elevates us, and it's an exciting place to be right now.
So what are some of your biggest lessons learned, some of the advice to share with innovators, entrepreneurs? There's so many great innovators moving here now.
Yes.
What do they need to know?
Just get involved, shake hands, meet people, ask a lot of questions. I would say in Colorado, there's never a stupid question to ask. People are so open and so willing to help you in any way that you allow them to. I was just talking to a company that moved here from Florida, and the one thing he said to me was, we chose Colorado because you were welcoming, because you opened your doors, and you made connections that no other community was able or willing to make. And so for a new innovator or someone coming into our community, just shake a hand, ask for help, and people are willing to do it.
And this really is a statewide thing. There's multiple ecosystems that's part of one bigger ecosystem here.
And we're all connected, right? Fort Collins, the Anschutz Medical Campus, Denver, Colorado Springs, everyone's connected. Everyone's talking to each other. We're all, rowing the boat the same direction. And so once you lock in with one community, you're really locked into the state as a whole.
If you could wave a magic wand, and really change and evolve one thing that would make the biggest impact, either to the ecosystem here or just to health in general, what would that ask be? What would that wish be?
So I think the one piece that we haven't tapped into are our patient groups, patient advocacy groups, and those people who really, at the end of the day, we're trying to serve. We've talked a lot about the innovators, a lot about how to restructure the healthcare institutions, but I think the patient voice is really critical in that process. I know many of our innovators will talk one-on-one with patients to get some guidance and insight, but I think the ability to elevate that voice and bring them in a more kind of cohesive way would be a huge kind of next step for our community.
So Startup Health is new to the ecosystem
Yes.
here. It's an honor to be here. How can we be most helpful? What
my
can
gosh.
Startup Health Colorado do to really be supportive?
First of all, I just want to say sorry to cut you off, how excited we are that you are here. We are thrilled to have this relationship with you guys, and to have the partnership with the health institutions and the university on the Anschutz campus. That is an amazing opportunity for us. I think what we don't do well, and we were talking about this earlier, is storytell. I don't think that our community is a boastful community where we are prideful about the things that we do. And so the ability to elevate those stories on a national level and to give context around what that means for people both in and of course outside the community is going to be a huge opportunity for us, and I think where Startup Health can play a significant role.
The story itself of the ecosystem and what a great place it is, but also the many stories
Yes.
of the exciting things happening here. I think
Yep.
shining a spotlight on that nationally, but also globally.
Yes.
I mean, I think there's a lot to learn from what's going on here and all the great work that the various people and groups have done here
Right.
that other communities can learn from. Predictions for the future. Where do you see things going?
It's all about, I think, precision medicine. I think it's all about ensuring that the patient has the right access to technology and to medicines that will treat them with the best outcome possible for themselves. We're all one person, right? I'm different than you, and so I really believe that the precision medicine's going to be where we go at the end of the day.
And there's so many extraordinary companies here that are focusing on that.
Yes.
It seems like it's a real, a lot of innovation going on in that area here. So I think that's tremendous. Last thing, one of the things that I think is great about Colorado is just the concept of health seems to be ingrained in the culture here.
It is.
What do you do to stay healthy?
Yes.
Advice for others?
Well, I do a boot camp with my husband,
Cool.
so 3 days a week we're out at 5:30 in the morning, exercising with a group of about 10 other people, and it's not just about the exercise, but the group of people that we share that with are just amazing, huge motivators, and just joyful people to be around. So that's really what gets us up, and then we get the benefit of exercise with that.
Fantastic. Well, thank you again for
Thank you.
everything that you do to really lead and support this ecosystem, and it's just tremendous to be a part of it. So thank you.
Thank you.